Welcome back at 7:15. Today marks World IBS Day, an international day of awareness of the quality of life issues faced by those with irritable bowel syndrome and to reduce the stigma surrounding it. Dr. Robin Staudinger she's a gastroenterologist from Touro, joins us now to explain the symptoms, causes, and treatments of IBS. Doctor, good morning and thank you for being with us.
Good morning. Thank you for having me.
So let's start off with the basics. I'm sure people have heard IBS. People may try to self-diagnose with themselves with IBS, but what exactly is IBS?
Right. So IBS is very, very common. In the US, probably up to 1 in 7 Americans will at some point be affected by irritable bowel syndrome. It is a diagnosis that's characterized by a combination of abdominal pain, bloating, and then also usually diarrhea and/or constipation. And it often goes undiagnosed because people are maybe a little embarrassed or shy to kind of talk about those symptoms.
And you mentioned some of the symptoms, but a lot of those could be some symptoms that you have for other reasons, or you just may have a sensitive stomach. Is that a thing too? I guess what would be the difference between the symptoms of someone with a sensitive stomach and somebody who might actually have IBS?
Right. So IBS, you'd really need to talk to your doctor about your specific symptoms because, like you said, a lot of those symptoms are vague and can overlap with a lot of other GI conditions. So your doctor will be able to tease out your symptoms and then also identify maybe some other symptoms like a potential gluten allergy or some alarming symptoms like bleeding or weight loss that might lead them to think about another diagnosis rather than IBS.
And doctor, are there any causes or known causes for this syndrome?
So at this point, the exact cause of IBS is not known. There are some risk factors and things that might lead you to be a higher risk patient to get IBS. It affects everybody. Women a little bit more often than men. It's usually diagnosed in people under 50, but it can affect any age. A family member who has IBS makes you a little bit more at risk of potentially developing IBS. And then one of the other causes is sometimes people develop IBS after another GI condition like a diarrheal illness or gastroenteritis, a stomach bug, and then they develop this lingering syndrome, which is IBS.
Well, doctor, the good news is there are treatment options out there should you see a specialist and get diagnosed with it. What are the options out there?
Yes, if you think you have IBS, you should definitely talk to a doctor about it because they'll need to tease out those symptoms and then potentially do some additional tests to rule out other diseases. There's no one test for irritable bowel syndrome. It's what I call a diagnosis of exclusion. So you may have to have some additional tests like blood work, lab tests, imaging test, potentially even a colonoscopy to look inside of your colon to rule out some of the other diseases that might look like IBS. And then once those other diseases are ruled out, then we can usually say that this is probably irritable bowel syndrome. And then we can talk about the management options. There's not a one size fits all for IBS. It's usually a combination of some lifestyle modifications like exercise, dietary changes can be very effective, and your doctor can talk to you more about the specifics, but potentially avoiding certain foods that worsen your symptoms. And then there are also medications out there that are effective for treating irritable bowel syndrome too.
But of course, the key is having a conversation with your doctor to eliminate and find out if this is in fact something that you're dealing with. Doctor, we appreciate your time this morning. Thank you so much.
Thank you for having me.